Oregon EMS Data System Hospital Training. Oregon's EMS Data System is available to hospital staff to retrieve patient care reports that have been submitted by EMS agencies transporting patients to your hospital. In this session, we'll provide an overview of Oregon's EMS Data System. Then we'll show you how to access the system and find and view patient care reports. We'll also show you how to record hospital outcomes for those reports. Oregon's EMS Data System acts as a hub for patient care report data from Oregon's EMS agencies. EMTs and paramedics are the cornerstone of this picture. They're the ones who go on the EMS calls, care for patients, transport them to your hospital, and write a report of the care that they gave on the call. Agency administrators use the information in this system to improve patient care in their agency. Hospital personnel, such as yourself, also have access to Oregon's EMS Data System. You can retrieve the patient care reports for patients delivered to your hospital. As a result, you'll have better knowledge of what happened out on the scene and can better prepare to treat the patient delivered to your hospital. You can also use the information in the system for quality assurance and performance improvement. Oregon sends some information from its EMS data system to a national EMS database. Some data in that database is publicly available, so you can also go to the national EMS database to run reports that help you better understand how EMS is working across the country, and perhaps compare EMS in your area to EMS elsewhere. In addition to EMS agencies and hospitals, several other people have access to Oregon's EMS data system, including county health departments, the state EMS office and public health officials, and researchers. In addition to retrieving patient care reports, Oregon's EMS data system also gives you the ability to record some hospital outcomes on those reports. The value of doing so is that it helps the local EMS agency to understand what happened to the patient after they transferred the patient to your hospital. As a result of knowing that information, the agency can improve the way it provides EMS care. The American College of Surgeons and other verification bodies often have requirements that hospitals share outcome information with their EMS agencies. Additionally, HIPAA, the Health Insurance Portability and Accountability Act, allows a hospital to share outcome information with an EMS agency who treated the same patient. If you have questions about the regulatory environment and how it both allows and requires you to share hospital outcome information with your EMS agencies, please contact the Oregon Health Authority using the contact information that we'll provide at the end of this session. Oregon uses a national EMS data standard called NEMSIS, the National EMS Information System. The first widely adopted version of NEMSIS was NEMSIS version 2, which was released in 2004. Oregon began collecting some EMS data electronically in 2007, but really ramped up its efforts in 2011. In the same year, 2011, NEMSIS version 3 was released nationally. Oregon is currently in the process of transitioning from NEMSIS 2 to NEMSIS 3. The state began collecting NEMSIS 3 data in July 2015 and plans to have all EMS agencies across the state transitioned to the new version by the beginning of 2017. Currently, over 80% of Oregon's EMS agencies are submitting data to the Oregon EMS Data System. When you log into the system, you will see patient care reports for patients delivered to your hospital a few minutes ago up to a few years ago. Regardless of which version of the data standard was used by the local EMS agency, you'll see a list of all patients delivered to your hospital in one location. The contents of those patient care reports may look slightly different, depending on whether the agency used the NEMSIS 2 or NEMSIS 3 data standard. So what is the NEMSIS data standard? The National EMS Information System is a national standard that defines 423 data elements that could be collected on an EMS patient care report. A core of those data elements are labeled as national elements. They're collected across the country in every state. Outside of that, each state has determined additional data elements that are important to collect from all EMS agencies across the state. Oregon has done that and has selected a state data set of just over 200 patient care report elements. Local EMS agencies may choose to record and submit some additional data elements on their patient care reports above and beyond the national and state core. What this means is that from a hospital perspective, you're guaranteed a certain core set of information on every patient care report, regardless of which agency it came from. Now, does every patient care report contain 207 data elements on it? No, it doesn't. It depends on the call. For example, there are several data elements relating to cardiac arrest and cardiac resuscitation. But those elements will only be recorded on a patient care report if there was cardiac arrest on the call. Next, let's discuss the process by which patient care reports become available to you in Oregon's EMS Data System. The process differs slightly depending on whether the EMS agency directly uses Oregon's EMS Data System or whether they use a different product and then submit their data to the state system. Let's first look at the process for agencies that directly use Oregon's EMS Data System. To begin, they get dispatched on a call and they begin to respond to the call. Sometime after they start responding to the call, they begin writing their patient care report. They provide care to the patient and they decide where they'll transport, and at some point they record that destination hospital on their patient care report. As soon as they do so, their patient care report becomes available to your hospital, even though they haven't finished the call yet and haven't finished their patient care report yet. You can begin to pull up that patient care report to see early information about the situation on that call. Eventually, EMS delivers the patient to your hospital, and the crew finishes their call. Shortly after finishing the call, they finish up their patient care report and they mark it completed. Afterwards, they may follow an internal agency review process within their EMS agency to make sure that their report was accurate and complete. They may make changes to the report over the next hours or days or even weeks. Eventually, the agency sends that report off to billing. This is the process for agencies using other data systems and then transmitting their data to the state. The process within their data system looks similar to what we just covered, but their patient care report is not submitted to the state system until after they have marked it completed or closed within their local EMS agency data system. What this means is for those agencies, you may not see a patient care report until after they've completed the call, or maybe even a day or two later. As soon as they do submit their patient care report to the state system, it immediately becomes available to your hospital if your hospital was marked as the destination for the transport of that patient. We encourage you to have an open dialogue with the EMS agencies that transport to your hospital to work on the timeliness and quality of their patient care reporting. Stay connected to your EMS agencies. And if you need help finding contact information, please get in touch with staff at the Oregon Health Authority. Well, it's time to get hands-on and log into Oregon's EMS Data System. There are two types of user roles. Hospital administrators have a role called Hospital Hub Local Admin. And using that role, they can set up access for other users. Everyone else has the Hospital Hub user role, which allows them to access patient care reports and record hospital outcomes on those reports. In order to get access to the system, your Hospital Hub local administrator first needs to create your user account with a temporary password. They'll give that to you, and you'll log in for the first time, and then you'll be prompted to create a new password for yourself. If your Hospital Hub local administrator has already created your user account, then you'll be able to use that account today to log in and follow along with this session. Here's the address for Oregon's EMS Data System. It's hub.emsbridge.com/OR. We encourage you to shrink this video into one corner of your screen. Go ahead and bring up a web browser and visit this address, hub.emsbridge.com/OR. We recommend that you bookmark this address in your web browser. This is the login screen for the Hospital Hub of Oregon's EMS Data System. If you've been given your user account, go ahead and log in at this time. If you don't have a user account yet, you're welcome to use the guest account so that you can follow along in this training. The username is guest, and the password is guest00. Every time you log in, you'll see this data privacy statement, which reminds you that the information in Oregon's EMS Data System is confidential. Click I agree, and you'll be in the system. I'm now logged in, and I can see a list of recent patient care reports for patients that have been delivered to my hospital. I can use Search to change what I see on this list. For example, I could limit the list to a particular date range, or to a particular EMS agency. If I know a certain patient that I'm looking for, I can put in their last name or their date of birth to search for them. I can also click the button that says Incoming, and this will give me a list of patient care reports for patients that have come to my hospital in the last couple of days. In this particular sample hospital, we haven't had any patients come in the last couple days. Let's go back to the search list. We'll leave everything clear and click Search to get back to our original list. I can use the Settings button to modify what I see on this list. For example, I can remove columns from the list, and I can add other columns. The top half of this list affects my search results, and the bottom half affects the Incoming Patients page. With the changes that I just made, I now see patient names on my list of patient care reports. Let's choose one of these reports and view it. I can click on a report to highlight it, and then click Print. This brings up a printable version of the patient care report for this patient. At this point, I could save this report as a PDF and attach that PDF to a hospital chart in the hospital's electronic medical records system. Or I could print the report. In this list, I only see patient care reports where my hospital was recorded as the destination. Sometimes I need to see more. For example, a patient may have been responded to at an initial scene, then transported to a first hospital, and then transported to my hospital for a higher level of care. I only see the report for the transfer to my hospital, but it may be important for me to also see the report for the initial scene response to that patient. If I think there are related calls, I can highlight the patient care report that I'm interested in, and then click Related. This will bring up a list of patient care reports that are related to the report that I'm looking at. And then I can view those reports. As we said earlier, it's really important for EMS agencies to understand what happened to their patients after delivering them to your hospital. It helps them to improve the care that they give. You have the opportunity to record hospital outcomes in Oregon's EMS Data System. To do so, select a report, as I've done here, and click Outcome. This will bring up a screen with some information to collect on the outcome of this patient. I can record the patient's emergency department disposition, hospital disposition, a patient registry ID, such as a trauma registry ID, their total ICU length of stay, ventilator days, and date and time of discharge, as well as the outcome at hospital discharge. To submit that information, click Save. And you'll be notified that the outcome data has been sent successfully. That outcome data is now available to the EMS agency so that they can understand what happened to this patient after transferring the patient to your hospital. I can click Close to return to the list of incidents. Thanks for watching this session, where we provided some background about Oregon's EMS Data System, and then reviewed how to log in, search for, view, and print patient care reports, as well as how to record outcome information. If you have questions or need more information, first get in touch with your Hospital Hub local administrator within your hospital. Next, you can contact the State of Oregon Health Authority, and you can get help from ImageTrend. In particular, you can use the ImageTrend University, which contains online help resources that you can use. Finally, if you want more information about the National EMS Information System data standard that we use, you can visit the NEMSIS website.